Thank you, members of the media. We again acknowledge and thank the Honourable Prime Minister for his address and his words of advice for us this afternoon. Again, reiterating the confirmation from the Honourable Prime Minister this afternoon, our fifth case has been identified. She lives in Lautoka, so has been confined in the Lautoka area over the last 10 days. She was a contact of our first case, as mentioned, and so upon the diagnosis of the first patient, she was advised to go into home quarantine, which she did with her family. She is again one showing example of what one should do with regards to the health advice on their conduct. She was visited daily by the health team, and then as stated last Monday on the 23rd, she developed cough and fever. She reported this, was identified by the response team, and was taken into Lautoka Hospital for testing and eventual confirmation of her suffering from COVID-19. So she is now in Lautoka Hospital in a stable condition. Her family under home quarantine and looked after by the health team and the police team. As stated by the Honourable Prime Minister this morning, two family members on the visit this morning, two family members were noted to be symptomatic. A 1 year, 9-month-old baby and a sister of the patient. So they are also now in Lautoka Hospital undergoing investigation and treatment. The patient's husband returned from Christchurch, New Zealand on the 17th. He was placed on home quarantine, and he is asymptomatic at the moment and under follow-up by our health team. In addition, just a brief update on the other cases we've had so far. So our first cluster of patients that we were informed of last week, the first, the second, and the third patients, they remain stable, in a stable condition. The first patient is remains admitted at Lautoka Hospital. The second and the third, the mother and the little baby, remain in isolation at Nandi Hospital. On our second cluster, who are now based at isolated at Nabua Hospital, the patient and the 4 members of his family remain in a stable condition, and they remain isolated at Nabua Hospital. Yesterday, the mother-in-law was noted to be symptomatic. She was tested and was confirmed to be negative for COVID-19. Maybe just to reiterate the important messages that the Honourable Prime Minister had shared this afternoon. It is important for those members of the public who have been identified to be possible contacts and are asked to be under home quarantine, that you should respect your status and remain under home quarantine. It is an important action that you do to assist in preventing the spread and the continuation of the disease in the community, and hence we should all, for those who have been told to maintain home quarantine for them, to make sure they respect and follow these instructions. As stated by the Honourable Prime Minister, it is a legal requirement It is a duty of care on your part if you're asked to be on home quarantine. And it is also your act of love towards your family, act of love towards your community, and indeed act of love for the nation. Maintaining social distancing, that's an important message that we've been sending every day, and we'd like members of the public to maintain and practice social distancing. I'm encouraged to see the members of the media attempting it today, and I hope that we will continue to do this when we are doing this daily press conference, maintaining social distancing. Whether you're sitting in a meeting, standing in a queue, working in your office, make sure you maintain social distancing of at least 2 meters between each other. Following proper cough and sneeze etiquette, the use of tissues when you cough or sneeze, or coughing and sneezing into your elbow, into your upper arm, to protect and prevent from spreading water droplets that can carry the virus. The use of the mask was discussed and it was asked in a press conference. The mask, yes, it is an important tool for prevention of the spread of the diseases. Medical masks are recommended, and the Ministry of Health endorses the recommendation of the WHO on the use of masks. So I will invite and ask people who have questions about masks, just go to the website, WHO website. There are instructions there on the use of masks, and the Ministry of Health is endorsing those recommendations for the use of masks. Basically, the use of mask is not, the use of the mask alone is insufficient. You must use mask and also practice hand hygiene. That is important. Using the mask alone is inadequate in preventing the spread of the disease. If you are well, you don't need to use the mask unless you are caring for a sick a relative or a person who has the disease. So if you are healthy, you do not have the disease, you don't need to use the mask. Hence the importance of preserving masks for those who will care for sick patients and relatives. We must not try and buy off all the masks that are in the pharmacies or sold by medical supplies companies, because it is important that we save those masks for those who will treat patients with COVID-19. And lastly, washing hands is important, and we are reiterating that we must frequently wash our hands with soap and water. When you are in a place that doesn't have soap and water, use the hand hygiene gel to clean your hand and clean your hands regularly. I'll stop there.